we have our panelists. We'll be having Florence, the key presenter, will be part of the panel. And then we'll also have Patrick Albert Ipola, who I would want to first of all introduce. Is a public health professional with a strong background in health systems, One Health, and laboratory science. He holds a Master's of Health Services Research and a Bachelor's of Biomedical Laboratory Technology from Makerere University. He currently serves as the Center Operations Manager at the Makerere University African Center for Emerging and Re-emerging Infectious Diseases, where he leads operational planning, resource coordination, and implementation of multidisciplinary research projects that are tackling infectious disease threats across Africa. He has previously worked with the Africa One Health Universities Network as a project coordinator, where he promoted collaboration across African universities to address interconnected health of people, animals, and the environment. His work reflects a strong understanding of animal health and welfare developed through these various roles that he has held and through his academic training. He has also served as a health supply chain technical officer at Medical Access Uganda, where he was managing delivery of life-saving health commodities. And his foundational experience includes work as a laboratory technologist at the Central Animal Diagnostic Laboratory and as quality assurance student with the Target Malaria Project at the Uganda Virus Research Institute. He is passionate about strengthening health systems, supporting One Health approaches, and advancing research and innovation across Africa. So you're welcome, Patrick, on this panel. And also joining us, on the panel is Angella Musewa, who is a highly motivated epidemiologist with more than 10 years of experience working in areas of One Health and specializing in understanding the interaction between livestock, wildlife, humans, and the ecosystem in Uganda. Angella has led several projects aiming at establishing the role of animals in viral hemorrhagic fever outbreaks in Uganda. She holds a Bachelor's of Biomedical Laboratory Technology and a Master's of Science in Clinical Epidemiology and Biostatistics. Angella completed a 2-year training in advanced field epidemiology supported by the Center for Disease Control and Prevention in the USA in partnership with the Makerere University School of Public Health and the Uganda Ministry of Health. She is also completing her PhD in tropical and infectious diseases. You're welcome, Angella, on the panel. To start off with our panel discussion, I'll start off with Florence. From your presentation, you have talked about involvement of county leadership. You've talked about the different counties, Baringo, Trans Nzoia, and the involvement of the leadership. Could you further highlight specifically the role that this local leadership has in One Health projects as far as enhancing the outputs or the results of the project is concerned?
Thank you, Paul, and thank you for your very significant role in building animal welfare knowledge amongst the communities we are working with. So most services are devolved to local county governments, including extension services, which include all the One Health related departments that you've heard us mentioning, like the veterinary, crops, environment, public health departments, and hence it's their mandate to align all projects, including the One Health ones, with the local government policies and local government initiatives and priorities. So they are also responsible for ensuring sustainability of initiatives that are beneficial to communities and proposing new policies to enable such initiatives to continue if they are not yet supported by existing policies. So for example, a policy on One Health support, which is not in place, is something that they are now going to take up and ensure that it is addressed, because when they have the policy, it's more likely that funding will also be provided to address these issues that we have been talking about. Another, for example, is that through this project, they became aware that they would need to have a policy, for example, on animal welfare, and they don't have it. And so they've taken on board this to be one of the things they'll do. So in overall, we can say that they are very key in terms of ensuring that anything being done, whatever it is aligned to the government priorities, and it's also integrated in what they're doing so that it is sustainable.
Yeah, thank you for that submission. And just to add, for every project you are looking at making sure that there is sustainability. So having your project outputs integrated into what is happening at the local level helps in sustainability. Okay, so moving on to Angela, and related to the continuing with this discussion, from your experiences, Angela, what are some of the strategies that project managers can employ to effectively cultivate transdisciplinary collaboration in projects addressing these One Health challenges?
Yes, thank you so much, Paul. Good afternoon, everyone. It's a pleasure to share my experience with all of you. I've served as a country manager for the last 6 years, and this position was under the Africa One Health University Network that has presence in about 10 countries across Africa. And my roles really were so much aligned to coordination, collaboration, but also advocacy in regards to One Health workforce development, community outreach, among others. And from that experience, I believe some of the key strategies that we need to agree upon, and based on what I did under my role, is we all need to agree that One Health is still young and it's still growing. What we observe in Uganda is that there are some sectors that are actually dominating within the One Health sphere. That's the Ministry of Agriculture, Animal Industry, and Fisheries, and the Ministry of Health. And there are other core line ministries that would factor in, but they have been not so much considered as we are talking about One Health and advocating for institutionalizing these initiatives that we are putting in place, such as the Ministry of Education and Sports. That is critical for us to implement One Health and to advocate for it right from the grassroots. As well as someone such elementary school, it's something that we need to factor in, and we have left out this ministry. And the same applies to the Ministry of Water and Environment and Wildlife. So in my opinion, one of the key things is to ensure that we have stakeholder engagement, and of course not leaving out the National One Health platform. We've seen that in countries like Cote d'Ivoire, in countries like Cameroon, where this is served it is housed under the office of the Prime Minister, One Health initiatives have started receiving funding directly through the central government, and there is little dependence on donor funding. So this is a strategy that we need to advocate for to ensure that all our activities are housed under the One Health platform, and this One Health platform is also housed within the ministry or the Prime Minister's office. One thing that I've pushed for during my tenure is joint planning and advocacy from inception to implementation. This has helped so much with issues to do with duplicating resources. We know that most of the One Health initiatives are really built on donor funding. So if partner X and partner Y plan in isolation, you will realize that some of the activities that CABI might be implementing, another partner could also be implementing. So we've always had to harmonize all One Health work planning annually, and also progress check for the different activities that all One Health actors and players are doing on a quarterly basis. The other key strategy that has helped us to take this further is to build capacity and institutionalize most of the programs. If it's academic-based programs, institutionalize them through the academic institutions. There are those institutions with rigid structures, but there are those that are flexible enough. So we need to start with those that are flexible enough. And it has worked out because right now we have about 15 programs where One Health has been strongly institutionalized, even without USAID funding. We know that it is going to be taught, and we expect that 5 years from now, our graduates will have the skills and competences to address community needs, or address challenges that require someone to have the knowledge of One Health. The other key strategy that I believe has worked out for us is not creating parallel structures, but working within the community health teams. If it is village health teams, strengthen those and don't create parallel, because like I mentioned, most of our funding is coming from donors. If there is no money, these existing structures will continue to deliver the One Health initiative. I thank you, Paul.
Right, thank you, Angela, for that submission. And moving on, I related to Angela's first question, Patrick, and also based on your experiences, how can we best sustain these transdisciplinary, the transsectoral collaborations? How can we best sustain them? Especially those that were created or cultivated during the project. How can we now sustain them looking at beyond the project?
Thank you very much, Dr. Ssuna, and thank you, team, for joining the call. And also, thank you, Florence. You've really set a good tone. Many times when we discuss One Health, when we discuss animal welfare, the challenge has always been, how do you demonstrate that animal welfare is important? How do you demonstrate that One Health is actually also important? Because to a common person, to a farmer, I would even call a peasant, not necessarily a farmer. A peasant meaning someone is really cultivating to feed his family and not even to sell. When you tell them that you need to practice animal welfare, when you tell them you need to practice One Health, they do not see the relevance of it. And what, Florence, you've been able to do is you've demonstrated that yes, animal welfare and yes, One Health are very key in order for us to get good livelihoods of our people. So I would really want to thank you for demonstrating that, but also WTS for the funding, because now we know that if you take good care of, say, of the animals, then if the animals are not consuming contaminated food, then you're saving the human being as well. So you're demonstrating that if you take care of your animal, then you get more yields. So what you've really been able to demonstrate through those linkages is really key. Now the question is, how do we sustain this? Angela's touched to some of the key things, and one of it is capacity building, in which I think you demonstrated again by really providing information to these local people. Information is really very key, because once people have the information, then they can start acting on it. Then they have tools that they can utilize to advocate. You talked in your presentation, you talked about policy influence. Was one of your recommendations. It's very hard for you to advocate for a policy when you do not have the prerequisite information that actually you need to advocate for that policy. So in order for us to sustain this, yes, we need policy, but what's the prerequisite before we get the policy is advocacy. And what is the prerequisite for advocacy? It's actually providing the information, which you're doing a good job. I was also happy with what you've been able to do around the manuals and then the guidelines. I think you said you had the training on animal welfare guidelines. Now, this is very important because now the community is better equipped to even advocate for certain services. Angela talked about planning. As the local governments are planning, the community and other key stakeholders. In Uganda, for example, we have the VHT system, that's village health teams. They can now, in their planning or micro planning meetings, they can now say, hey, let us not forget that we need to be able to plan for our animals as well. We need to equip farmers with the tools that, for example, say vaccination of dogs. Some people have dogs, but they may not know that you have even to vaccinate against rabies. But now they can now go with the information that you provided and say, hey, the district, do you have vaccines? Or if you don't have vaccines, can we advocate that governments provide subsidized prices for the vaccines? So I was really happy to see that coming in from the work that you're doing. And now that we can see that the community is actually better equipped, and hopefully from what from my understanding is you didn't roll this out entirely for in a large scale. Perhaps lessons that we can pick from here, we can see what can we pick and implement in a larger community. So for me, really, Dr. Ssuna, in terms of the question you asked, how do we sustain this? One is capacity building, two is advocacy, more advocacy, and three, you need a policy, because when you have a policy, then you're sure that this thing is going to be sustained. When you have training, like Angela said, then you're sure that the graduates that are going to come out are equipped with the knowledge. If, for example, we're training people on both animal welfare, we're also training them on One Health. It means the people who are coming out, the professionals who are coming out, are equipped with this knowledge. They're also able to start conversations around the need for the policy that you earlier highlighted. And thanks to AFROHUN, they already have some very interesting courses actually in the space of risk communication. They have courses on also One Health, which are very fundamental for this. Thank you, Paul.
All right. Thank you, Patrick, for that elaborate how you have elaborated that point, and the different suggestions that you have given. They so much relate. If we can recall what Florence has presented, and I know, Florence, you touched the point of some of the gaps that project implementation, and how you addressed and brought out that integration of One Health and animal welfare. But I also wanted to pick up on the knowledge gaps, specifically the knowledge and awareness gaps that you saw among the stakeholders that could have potentially undermined the project's approach. And also, if you can tell us on how these were addressed, especially considering the diversity that was there and this being in service professionals.
Okay, thank you, Paul. Yeah, so generally we had very good support from stakeholders, and they were very enthusiastic in participating in the project. But like all projects, there are always challenges, and I think one of the ones we had for the clinics was lack of awareness on the benefits, for example, that could come from joint livestock clinics, which affected the level of attendance that we had expected. But this was we addressed by raising more awareness on the clinics through branding, for example, and also raising awareness through existing channels, like through their community communication channels. The other issue, it's not really about knowledge, but it is expectation that farmers, for example, were expecting to get agri inputs also provided during the clinic sessions. And maybe that is something that can be considered in other One Health projects, that beyond giving information and knowledge, there could be some seed support for them to be able to take up some of the interventions. Government officials, in some cases, not maybe having the resources required to attend to the activities. But now going back to knowledge, I think or awareness, I think the main challenge that we faced was not having structures in place that enable collaboration or inter-sectoral collaboration to address One Health. And therefore, in the project, we had to look for ways of bringing these different institutions together, try to demonstrate the importance and the benefits that can be accrued from that sort of setup. So I think the other issues to do with knowledge basically were around the animal welfare. When you say animal welfare to people, some people, it doesn't really ring a bell right away. And so it being taken up to become a policy issue that needs to be addressed separately was not very quickly taken on board. But at the point where we are, we have a good feeling that people are starting to appreciate that even though they are funded as vet officers or livestock officers to do what they do, they still need in their local government to think about animal welfare as a standalone issue because of the implications that it has. In some cases also, one of the things we noted, I don't know whether it's an attitude or just not being consciously aware, is that sometimes when you talk about animal welfare, people think, we have more serious problems of human welfare and we don't have resources for drugs, medicine for human health. And now we are talking about animal welfare. So I think demonstrating that link, that even though you don't have those other necessities for humans, it will only be worse if you're not going to address animal welfare, because it's only going to make the issues you have, for example, the health issues, even much worse. So those are the sort of things that we were dealing with. And I think from the training that was undertaken on animal welfare, and also the development of the standard operating procedures, which they have agreed to take on board, they should be in a better place moving forward, and it will be easier to undertake One Health projects in future or initiatives. Thank you.
Right, thank you, Florence. Indeed, you've touched the point of prioritizing animal welfare amidst there's so many challenges that the county might be grappling with, and actually prioritizing it as a policy issue. So that is indeed one of the major challenges that we have, not just in projects and then, but also I would say in majority of the developing countries. So this presents one of the ways or opportunities on how it can be addressed.